joining us from Malaysia, and he will moderate the session this afternoon. Thank you.
Thank you, Ms. Ayodele, and very good afternoon to everyone. Good morning and good evening for those who are joining us in this session. Assalamualaikum and good day to everyone. First of all, I would like to thank the ESCAP and development partners for its continuous support to the Asia Pacific Statistics Week 2020. This program is one of the most successful program of regional program on economic statistics for Asia and the Pacific, or RPES. I would like to welcome everyone to this session on the virtual forum of APS 2020. As of yesterday, we have 210 registered for this session. From organizer side, we have Ms. Ayodele Marshall and Ms. Ha Nguyen from ESCAP, who will be partnering with me to organize the session. Ladies and gentlemen, session SB1 will be focusing on how can quality be instilled in official statistics. As a background, assuring quality and instilling trust in statistics SB to be the key mandate of every National Statistical Office. Without quality, can official statistics be trusted? In this session, we will be hearing 6 presentations from distinguished authors on assuring quality and instilling trust of statistics in National Statistical System. We have 6 presenters with a very informative papers. This year, we have a broader scope of statistical discipline, and this is in line with the aim to attain our collective vision for transformation by pursuing 2030 agenda. Our session basically will be divided into 2 parts with 3 presenters for each session. Presenters will be given 8 minutes each, and then the question and answer session will be opened up. Participants are encouraged to ask questions to presenter by indicating your question via chat box. Ladies and gentlemen, for the first round, we have 3 presenters. We have first paper titled Strengthening the National Statistical System Through Language Policy, a case study in the Statistical Center of Iran by Mr. Sadati Norshabadi, and he's currently serving Statistical Center of Iran. The second speaker will be Mr. Mahesh Kumar from Central Bureau of Statistics. He will be presenting and integrating user satisfaction in agricultural statistics, the case of Nepal. And after that, our third presenter, Mr. Fayaz Ahmad from Pakistan Bureau of Statistics. He will talk about price statistic collection, reforms, and public confidence in Pakistan using statistical tools. Without further ado, I will invite Mr. Sadati from Central Statistical Center of Iran to deliver his presentation. Please, the floor is yours.
Greetings to all. My name is Sadati Norshabadi from the Statistical Center of Iran. My presentation is about how we can strengthen our national statistical system by using a proper language policy. My presentation is about the last round of population census in Iran, which took place in 2016. As we know, population census serves an appropriate tool and provides us with many important information on different aspects of the society. And the data provider, the respondents are the population, the people who live in the country. As we know, the population census provides the information needed for policymakers to provide us with proper development programs. And as we know, the 2030 Agenda for Sustainable Development consider that all the people matters, as it was one of the slogans in our population census. In my presentation, I focus on the language and the society, the language policy we use to encourage people to participate in the census. As we know, language is part of the identity and is a symbol of the unity of the society. In the 2030 Agenda, all the members stated focus on the dignity of the people for the promotion of the well-beingness of the people around the world. Language policy, which I focus on, is about the policy which every country uses for all the related matters to their language in the society. And especially in the Statistical Center of Iran, we consider that all the peoples, and in every country it is considered that all the people from different ethnic groups, their statistic is important for the development program, and we should ensure people that they are statistically included in everything. People from different cultural ethnicity, different cultural background, all of them are necessary for our statistical purposes. And for conveying this message to the people that you are important, it is not matter from which groups, from which ethnical groups you are in, you are important. And conveying this message to the people from different parts of the country, from different cultural background, was so important that we used a language policy to conduct this message to these people. We thought that if authority use the language that people think it's better for them, if the authority use the language which the people are comfortable with them, it will make them easy to participate in every statistical survey, as it is considered in the strategy of no one left behind adopted by the countries who approved the SDG. The methodology we used in our last census of population, two matters were very important. First one was the confidentiality and the privacy of the people, and the second one was the participation rate of the people. In this regard, we conducted and designed different working groups, included different experts from different matters, and in these groups we provided and we established special groups for publicity, and 2 persons in charge of public affairs and advertisement in every provinces and sub-provinces were assigned. We provided a guidance for publicity and published it for all the provinces, and in this guideline we clearly assigned a roadmap for publicity for this census. The ultimate goal for the Statistical Center of Iran by publishing this guideline was to increase the statistical literacy, awareness, and culture among the respondents. We thought that if people feel comfortable, if people are motivated to take part in the population census and ultimately in every statistical activity, it will contribute to the low rate of non-responses. The people in charge of publicity campaign in different provinces were free to provide many publicity leaflet, to produce program, TV shows, radio programs to motivate people. And one important thing that was clearly assigned in our language policy, that we use the formal language, which is the standard Persian, for the national publicity, and in the provinces the people in charge of the publicity were encouraged to use the spoken dialect, to use the language of the minorities, and in other words, to use the language that people are comfortable with it, for making them familiar with the population census, to make them comfortable with the information they provide to us. And
Excuse me,
By,
2 more minutes.
yeah,
Please.
2 more, okay. And in other words, the spoken dialect, the spoken language of every provinces paved the way for the high participation rate of the people. We won the heart and the minds of the people to take part in our population census by encouraging them by using their own language. This strategy showed its effect in the result of the e-census participation rate, which showed that about 50% of the population took part in our e-census, which was second to none among other countries. In this table, I show you the participation rate of the people in the e-census of different countries, which shows that the status of the Islamic Republic of Iran is very unique. In other words, and my last phrases is that we use the proper language policy by using the spoken dialect, by using the language of the minorities to entrust them that the information they provide to us is important for their promotion, for their well-beings. The language they honor helps us to make them familiar with every statistical activity in this country. And the ultimate word was that multi-voicedness used in publicity campaigns overcome the fear and doubt of people to provide statistics on themselves. Thank you very much.
Well, thank you, Sadati. Yeah, it's very interesting topic. Basically, for those living in country with high population numbers, I think one of the great challenges is to ensure everyone is counted in economic census or housing and population census. So I think we will proceed with the second presenter. For those who have questions, I think you can speak that at the moment. And can someone there's some interruption there. So I will go to the second presenter, Mr. Mahesh Kumar from Central Bureau of Statistical of Nepal. So this is something to do with the how we can use users' feedback.
Excuse me, Yazi, just a minute. We're hearing some background noise.
Yeah.
We're just asking everyone to mute their microphones, please.
Okay.
Thank you.
Thank you. Don't let your microphone unmuted during the presentation, please. So let's have another presentation from Dr. Mahesh Kumar from Central Bureau of Statistics of Nepal. Basically, this is something to do with how we can make use of users' feedbacks from user satisfaction survey to improve our statistical production. So in the case of Nepal, I think agriculture plays an important role to its economy. And of course, one of the key challenges of agriculture is about fundamentals, about how we can construct the fundamental to build up the capacity and also how to meet the aspiration of the users. So with that, I invite Dr. Mahesh Kumar to present his findings from his paper. Thank you. Please proceed.
Thank you. Good afternoon. My name is Mahesh Subedi from Central Bureau of Statistics of Nepal. My presentation is about integrating user satisfaction in agricultural statistics of Nepal. So the main objective of the study is to show how the users' demands and feedback obtained from the user satisfaction survey are being used to strengthen the quality, coverage, quantity, and use of agricultural statistics in Nepal. its introduction is that the CBS has conducted a user satisfaction survey in 2017 to assess its data use, data demands, and level of user satisfactions, and towards its statistical product and services. And it also received the feedbacks from the users to improve the statistics sectors. So one of the sectors to be improved is agricultural statistics. So my paper is mainly based on the finding from the user satisfaction survey. What is the evaluation of user satisfaction survey on agricultural statistics, and what we have, the CBS has taken what step has CBS taken to improve the agricultural statistics of Nepal. So the main finding of the user satisfaction survey are that the agricultural statistics produced by CBS is one of the least used sectoral statistics. You can see from the figure that only about 3% of the respondents have used the agricultural statistics. And then overall quality of the agricultural statistics also found somehow comparatively lower than the other sectors. And also the statistical reports lacks statistical, analytical or thematic analysis. And
Mahesh,
the data.
Can you change the view into a presentation mode so that you can manage your presentation more effectively? So here we just see it at the not so yeah. Can you
can you see now? Sorry. Can you see now?
Not yet.
Yes. It's why not working? Yeah. It's
okay.
Can you?
Never mind. Yeah. You can come back to that original setup, but I think you just scroll down and scroll up to ensure we can follow your presentation well.
Yeah.
Just carry on, please.
Yes, please.
Right.
It's okay that I can read. Or you could show it from that from your side. Okay. So can I carry on my presentation?
Yes, please.
Yes. So the findings from the user satisfaction survey was that the agricultural statistics is one of the least used agricultural statistics, and the quality has also the quality is also found comparatively low, and the publication lacks thematic or analytical reports, and the data, especially the microdata or the aggregate data, are not directly available from the websites. And also the user feedback to make the survey census that has been conducted by CBS for more informative and useful to users are that the user suggested to do more consultation with the stakeholders, coordinate with similar data producer, identify users' needs, and provide the disaggregate data up to the local levels. And also the user suggested to promote the use of statistics by timely updating users with new data and publication availables, and provide a digital copy of data and publication in website for easy download and use, and also conduct statistical literacy and advocacy programs. And the user also suggested, or especially they wanted some new area of statistic related to agriculture. For example, the disaggregated level of agricultural statistic up to the local levels, and also environmental statistics, especially the environmental impact on agricultures and land use statistics related to agricultural statistics. That are some of the demands from the user side to strengthen or to improve the agricultural statistics. And we have done several consultation meetings with users based on the findings, and we found the possible causes of low use of agricultural statistics could be the low frequency of agricultural statistics, especially the current agricultural statistics. and sort of some socioeconomic variables, and it's direct link to the society, key aspect of the society. And the agricultural statistics also lacking or missing some important activities like commercial agriculture activities, land use and production method, food loss and food securities, and the use of chemical fertilizer, pesticide, and its impact on human health, and environmental impact on agricultures, and also inadequate advocacy and data availability are reported by the stakeholders, and ineffective disseminated statistics. As I already said, the data are not directly downloadable from the website, and also thematic tables, thematic reports are lacking, and based on the findings and users' feedbacks, the CBA has taken three-step strategy to strengthen the quality, quantity, and use of agricultural statistics. The first step is to address the data needs. It's mainly the promote the volume or the flow of the agricultural statistics. So we have started the annual agriculture survey program, that is agriculture integrated survey has already started in CBS, and we also started improving agriculture census questionnaire to capture or to accommodate more coverage, and also expand the size to give the disaggregated table data up to the local governments level. Previously, we used to give the district levels statistics. Now we are planning to give more disaggregate levels static up to the local government level. And also we are planning to capture the commercial agriculture activities, and we started it from the agriculture survey, and we are also we are planning to capture the agriculture census. And to improve the data quality, we are improving the methodology, tools, and technologies. And for example, the methodology will follow the international recommendation or concept definitions, especially the old the FAO, the old program for the agriculture census methodology and guidelines, and the face-to-face interview will be supported by the crop cutting or remote sensing surveys, and the CAPI technology or GIS or satellite images will be used to reduce the gap between the data collection and the data analysis, and to expand the data use.
Excuse me, more minutes, please. Thank you.
To expand the data use, the microdata will be provided by in a website, and for that purposes we are starting drafting the data microdata dissemination policies, and we are also preparing the more advocacy material, especially for targeting the agriculture census advocacy, and also planned for producing more thematic reports from upcoming census and survey, and also planning for publishing or compiling the agriculture SDG indicators related to agricultures. And in conclusions, the finding and feedback received from the agriculture, the user satisfaction survey were found very useful for CBS for the improvement of its activity and output. For example, the CBS website is now completely changed and made user-friendly. This was shown by Gemma in this morning also in her presentations in opening sessions. The draft of formal data dissemination policy and guidelines was prepared and submitted to Parliament for the approvals, and a three-step action plan has been taken for improvement the quality, quantity, and use of the agriculture statistics. It's what I just said now. And this paper that the user satisfaction service is found one of the very useful tools for countries, especially for SNs, to integrate its users' satisfaction and for the improvement of these statistics. And main recommendation of this paper is that the instrument survey is tools for improving or integrating the user satisfaction and needs, and for the improvement of the agriculture statistics sectors identified, which has to be improved. Thank you.
Okay, thank you. Thank you very much, Dr. Mahir, for a very informative session. And I believe all the audience may have certain inquiry for it later. But now I will proceed the session to the third speaker, Mr. Fayaz Ahmad from Pakistan. I think we will be talking about the price statistic in Pakistan, what have been done in terms of reforms and how to instill public confidence. He is using a TPAD statistic in his study and together with a regression model. I think without further ado, I think I will let Mr. Fayaz Ahmad to present his paper. Thank you, Mr. Fayaz. You are welcome to the session, please. Mr. Fayaz, you can.
Fayaz, could you please unmute yourself and also put your presentation in presentation mode by either clicking F5 or looking at the icon at the bottom and click that, please.
Okay. Okay, thank you. Hi everyone, I'm Mr. Fayaz Ahmad from Pakistan, and I'm talking today. My presentation topic is about price statistic collection reforms and public confidence in Pakistan. So everyone know about the importance of price and their society. Many things, each and everything have price. Many commodities and many goods have their price. So definitely the paper goal is about the new reforms which is carried out in 2015 and 16. So we will focus about that, to test about the confidence of our country people, that the confidence about their confidence about the prices boast of are not due to these reforms. So the basic in our country, we use three type of price indexes: the consumer price index, which are listed in this table, and sensitive price index, which is also listed in this table, and the next one is the wholesale price index. So welcome to all methodology. So we use two types of statistical tools to test the public confidence, and we choose the consumer price index for this purpose. So the reforms before 2007 and 8 and the reforms after 2015 and 2016. We use t-statistic to choose before the reforms the confidence of public on price, and after the reform the confidence of public on price. So peer t-test is used for that purpose. And another one, we use OLS regression model to test these consumer price index. State Bank of Pakistan has conduct survey about collect these statistics, and Pakistan Bureau of Statistics, which are responsible for different type of surveys and different type of official statistics collection, is also carry out these analysis. So we are going to discuss some reforms. Pakistan Bureau of Statistics has been a national statistical office, and it is a basic goal is to collect and compile official statistics, which is collected from 11 different sectors. Before 2008 and 2007 and 8, after the independence of the country in 1947 and 1949, the Pakistan Bureau of Statistics has established their use a different type of tools to collect price statistic index, and after the time 2015 and 2016, the reforms has come forward to their extent, because if we look out our country geographical location, so we have dispersed population, many of population living in rural and urban areas. So before these indexes was used, and 63% of our population are rural areas. So these reforms change some different technologies. They use geometric mean for the basic purpose, and also they introduce some new technologies, like on the base of geometric mean. They use some technological they use some technologies to collect these price statistics. So Results and discussion. So when we carry out the test statistics, the results are significant, and we reject the null hypothesis that people have no confidence after the reforms. So the reforms have perform a significant confidence on the people. And another one, we use the regression model, and on the base of this regression model, we see that our our model is significant, although the R square value is less, it's 0.38, but if we include some other variables in the model, so obviously they will be the R value will be rise. The next one, discussion and recommendation. So on the base of this paper, we use Pakistan household economic surveys and the data from Pakistani household economic surveys from 2015 and 16, and average commodity per family in Pakistan is the average consumption per family in Pakistan is 33,578 per month. Threshold having chunks 35% of the money on food. This show the sensitivity of the atoms. Poor, low, like for example, lower 20% households spend almost half of their expenditure on food and food item. Pakistani societies come huge amount of wheat, rice, and milk. Obviously, Pakistan is an agriculture country. 70% of our population is agriculture, depend on agriculture. So they have different prices. So another important group commodities on which consumers spend their income is energy. The household average consumer 24% per month on fuel, which include firewood, electricity, and gas. Electricity is too much expensive commodity because due to some recent energy crisis. So we consume half of our household budget. The urban population of country pays 81% for two major commodities, electricity and gas. Similarly, firewood and electricity are main sources of heating and cooking of rural population. One important fact, rural population is widely used biomass cooking purpose. The trend should not be discourage of conversation of suitable use of energy sources. Some important implication may be down from household economic survey, which is carried out after every 5 years in our country. Average household consume money on food item price statistic expectedly provide the latest level and inflate the food item most come from agriculture sector, which need
Excuse me,
long-term
2 more
planning.
minutes, please.
Okay, ma'am. So our conclusion and recommendation is that on the base of these tests, we show that the new reforms boast of the confidence of people, public, and price statistic. And there are the recent government performs some new planning. They change, they make a commission about to change the basic structure of Pakistan Bureau of Statistics. So hope so. The new reform has also changed some new on the base of the agenda 2030. So they will carry out different type of confidence in the people. So we can recommend on the base of this paper that a special survey should be conducted for measurement public trust following the pattern of UK Statistical Authority. Provincial Bureau of Statistics should be include generation of these statistics. Provincial Bureau of Statistics should also carry out family budget survey for development of provincial price index. Government should effectively utilize statistic and minimum wages rate laws satisfied uh, recent strategies. So these are our paper findings, and these are some references, and these are some outputs of our statistical analysis on the SPSS. Thank you so much all.
presenters for the first round of the session. Well, Ayodhya, can we open it for Q&A now?
Yes.
Yes, please.
Just anyone who would like to seek clarification or asking question, you just can raise hands or just write it in the meeting chat. Yes, please. So we have a very interesting topic. We are beginning with we begin with some info about how language is plays important role in getting more response during the housing and population census in Iran, and then after that we also foresee how users can get feedback to the National Statistical Office, so that in the planning itself for the future plan, they can really take into consideration of all these inputs, and also Fayaz also suggesting quite a number of initiatives that can be taken by the government to improve the statistic in the future. So yeah, please, anyone so far? You also can communicate by raise your hand.
We have a question from Dr. Marcelin, one of the presenters. This is to Fayaz, and he's asking, how regular are these price statistics being disseminated? It's a two-part question. How regular are the price statistics being disseminated? And who are the end users of the price statistics? So I'll read again. How regularly are these price statistics being disseminated? And then the second part, who are the end users for these statistics?
Okay, ma'am. So, and every month, these statistics are collected from our ground provincial bureau of statistics. There are 4 provincial bureaus of statistics in Pakistan, and each province. And Pakistan Bureau of Statistics is a national official statistical organization. These are NGOs which are responsible for the collection of these prices. So each and every month carry out they measure these price statistics from their provincial bureau of statistics, from their regional offices. You get this?
Thank you for us, Fayaz.
Welcome.
Yes, and we have another question from Nurul Ayini, and this is for Sadati. How many languages or dialects are there in Iran? And does all publicity content, is all of the publicity content then translated into those dialects? I think from your presentation, you indicated that you source the data using the dialects. So this question is, then when you are publishing the data, is it then translated into the dialects? And that's for you, Sadati. So I'll repeat again. How many languages or dialects are there in Iran? And then when you publish the content, is that then published in those dialects?
Okay, this question needs some clarification. From the linguistic point of view, we have language and dialect. Language refers to something which has written form as well as the phonetic form. Dialect refers to a language which has a phonological, phonetic form, just voices, not a recording, not a writing system. In Islamic Republic of Iran, we have one formal language which is called Standard Persian. We have also some other dialect like Turkish, Gilaki. In other provinces, we have also the spoken dialect. In every provinces, we have dialects, many different dialects. Some popular dialects in Iran are Turkish, and somehow for determining whether or not a kind of language is a dialect or language, it needs some linguistic point of view, which is out of this scope. And about the result of the population census, the population census is formally translated into Persian and English language. For publicity, internationally, we use the English language. In
Yeah, we have some connection issue here. Sadati, can you?
We'll give him about 10 more seconds, and if we can't connect, we'll go on to the other question. I think I hear him coming back in. Is that you, Sadati? No?
Can we go to another question, Ayodel?
Okay, we'll go to another question. That's to Mahesh. Why was commercial agriculture activities not captured previously in Nepal? Is there a reason why it wasn't previously captured?
Yes, thank you. And previously, we used to capture only the agriculture activity conducted by household. So household may have the commercial activities, but this time what we mean the commercial activities that commercial activity conducted by institution or enterprises. So earlier we haven't captured the commercial activity conducted by the enterprises or institutions out of the households. So we used to collect the agricultural activity earlier only conducted by the households, but not the enterprises or the institutions. So that's the main reason that this time we are trying to capture the commercial activity conducted by household and also by the enterprises and institutions. Thank you.
Thank you.
Okay, thank you so much. It seems that we have lost Sadati, so we will try to get him reconnected shortly. There is one other question for, I believe, Fayaz, and he has been answering the questions in the chat box as well. This question that you haven't answered yet is what particular information and insight were provided by performing regression analysis? And that's Nancy Tandem. She's asking what insight was provided by your performing the regression analysis on the price statistics user satisfaction. And that's for you, Fayaz.
So ma'am, we use OLS method, simple regression model on consumer price index. So this is very simply, we use statistical regression model and we use consumer price index and perform OLS, ordinary least square estimation method.
Okay, and what information were you able to collect using that regression analysis? Was there any particular insight? What was the confidence level produced from doing that regression analysis?
So
go on.
Hello.
Go on.
Yeah. Yes. So the consumer price index, the consumer price index have different types of commodities in this group: food and non-alcoholic beverages, alcoholic beverages, tobacco, narcotics, country, whatever, house, water, electricity, gas, and etc. Health, transport, communication, and many more, education. So we use all these. The overall performance of the model is significant. So we reject our null hypothesis that on the base of consumer price index after the reform, the public confidence is not boost up. So we reject the null hypothesis on the base of this the regression model, and our finding is significant.
Okay, thank you, Fayaz. Part of your response wasn't that clear because you broke up a little, so I'll get you to just type that response in the chat if you can. If you can't, we will follow up the answers with a response after the week.
Okay.
We will collect all the questions and submit the responses at the end of the week.
Okay.
Thank you.
Welcome.
Well, I will just give a minute for Sadati, just to conclude your answer for the respective question. The short one,
Okay, thank you. Okay, I was telling that in the result of the population census was translated into English language and was published on our website.
Okay.
And all the provinces and all the spoken dialect in my country and the people who use them can understand the Persian language. Officially, we do not translate the result of the population into the spoken dialect because the people talking those dialects can talk and understand the standard Persian too. And those dialects in Iran do not have any written form. It is not possible to translate anything for them. They can orally talk and understand the Persian language. Our formal language, they have no problem with that language.
Okay, that's good. Yeah, it's very interesting finding from your paper that you said that Pakistan already achieved around 40% of response via e-census. Maybe we'll talk about it later. I'm also a bit quite interesting topic there. I think Ayodel, can we conclude for the first session, and then are we ready for the second session of this SB1? So just asking for presenters to prepare. I'm asking presenters to prepare so that we have a short break, very short one, so that the next presenter, which is Dr. Musalin, can deliver his presentation short while.
Very quickly, we just want to inform everyone not to leave the group chat because the great break will just be a minute or two. Get up, stretch your legs, get some water if you need to, and this is just to have a refresher. Just to correct you, Yazid, our next presenter will be Ganesh. And then Dr. Mursalin, no, that's fine. And then Dr. Mursalin, and then Manuel will round us off. And then we'll have another 15-minute round of question and answer. And like I said before, any questions that have not been answered adequately in this session, we will collate them and publish the responses after the week. Thank you. So we will start that at 1:48. So 48 minutes after the hour. Bangkok time. So just a 1 minute break. Thank you. Good day to everyone again. Letting you know that our break is now over and we will resume right now. Over to you, Yazid. Yazid? It appears that Yazid is having connectivity issues, so I will just have Ganesh start his presentation if he's there. Ganesh, are you there? Good afternoon, everyone. Good day to you. Just bear with us. We're having some connectivity issues, so please just bear with us. Hi, Dr. Masali, and I see your question. I'm not quite sure. It seems some people are having connectivity issues and some people aren't. Yazid has dropped off the call. It seems that he's rejoined us. Hi. Hi, Yazid. You are still on mute. Could you please unmute your button?
Okay, sorry for that. I'm just lost the connection just now.
Yes.
So
Yazid, I am not seeing.
yeah.
I'm not seeing Ganesh and I'm not hearing him, so I'm wondering if he's having connectivity issues. Oh yes, he's there now.
Okay.
Thank you.
Nice. Thank you, everyone, for
Thank you for
staying with
bearing
us.
Thank you.
Yeah.
Okay. There's another interesting topic. This afternoon we have Mr. Ganesh from CBS of Nepal. I think this paper is about how CBS reacted to the new forms of federal setup or federal, what we think about federal government. There's some implication on the legislation and so on. I think this is really a good experience that CBS can share with us here in Asia Pacific region. So I think, Mr. Ganesh, you can proceed now with your presentation. I think this is really interesting things to hear from you. Thank you. Yes.
Yeah, please slide, please. Slide, please.
Hi, yeah, just bear with us. We'll share it shortly.
Yeah. Yeah. Good afternoon and welcome to all the participants. And I'm Ganesh Moyal from Central Bureau of Statistics, Nepal. And today I'm going to present on reviewing National Statistical System of Nepal in the new federal structure. Next slide, please. So in relation to background, beginning of statistical system of Nepal after the first population census in 1911. And the Census Act in 1951 paved the way for the operation of the fifth population census in Nepal. And the first Statistical Act in 1958 regulated and legitimized statistical activities in the nation. And it also contributed for the establishment of CBS as the sole custodian of official statistics in Nepal. And similarly, consolidated National Statistics Plan in the year 2000 was formulated to reorient and restructure national statistical systems, and it contributed for the incremental reform in the NSS. And similarly, government of Nepal recently approved national strategy for the development of statistics to update and improve statistical system, statistical activity in the NSS. Next slide, please. A new statistical act is under the consideration of Parliament. Similarly, CBS is also conducting censuses and periodic surveys, various periodic surveys in the time interval. And similarly, there are various ministries and their agencies are also conducting surveys to address their situational need. And Nepal is now in the transitional phase from unitary form of government to federal government. And there are 3 tiers of government: federal, provincial, and local. Next slide, please. And the main objective of the paper is to review National Statistical System of Nepal within the new federal structure and to suggest way forward to strengthen it. Next slide, please. And methodology adopted. National and international study reports and articles are mainly National Strategy for the Development of Statistics has been reviewed while preparing the paper. Similarly, Statistical Act and Regulation, Constitutional and Contemporary Legal Provision, current national and international issues have also been reviewed. And similarly, discussion with the experts and the authors' empirical ideas over the years have also contributed for preparing the paper. And descriptive argumentation has been followed to explain the subject matter in course of preparing the paper. Next slide, please. Now, prevalent issues. CBS is still at the nucleus of the system and the core of the data ecosystem for the 761 newly constituted government as per the federal structure. There is absence of well-coordinated, proactive, and competitive statistical system in the NSS. Similarly, National Statistical Council as the apex body of the National Statistical System is inadequate and incomplete and not inclusive to address the newly established federal structure of the country. Similarly, there are other issues of data quality and standards by the lower government if they are newly formed, and there is also lack of interagency, inter-level coordination, and they should have the facilitating roles for the statistical activities conducted by the federal government. And there are also other issues of international standards and classification, and the fundamental principle of official statistics recommended by United Nations. There is some height in the slide. Can you move forward the slide? As I will read from this slide. Yeah, next. And there is also a lack of structure for networking and sharing the data, best practices, and cooperation and coexistence. And similarly, there is also lack of institutional setup within the province. And there are some issues of strengthening statistical units and capacity building, career development of the lower structure to conduct statistical activities for the development plans and projects. And there are other issues of physical statistical infrastructure, financial resources, and equipments throughout the layers of government. And there is also lack of integrated and updated data profile to provide the common platform to supply and use the data. And similarly, there are also other issues of national, provincial, and local level indicators for the SDG. And another prominent issues of updating Statistical Act as per the new constitution to address the federal structure of the government. Next slide, please. And way forward are the steps taken to improve the situation. The National Statistical Council should be restructured with addressing, including the representation from the 3 layers of government, and CBS should be transformed to the National Statistical Office, and the trained and skilled human resources involved in the statistical field should be deployed to National Statistical Office and other statistical agencies and units, and expertise service of the best practices and knowledge and skills should be exchanged between the government units, levels, and the universities and other private research institutions. And similarly, survey clearance systems should be implemented for the timely and quality data and to lessen the respondents' burden and to address the issues of inconsistency of data. And similarly, national data profile integrating quality data and indicators from the lower level of the government should be designed, and similarly, strengthening of national account system with its institutional capacity to publish to forecast the quarterly as well as subnational GDP. Next slide, please.
Excuse me, 2 more minutes, please.
Yeah, please. Next slide, please. Yeah. So, coordinating with the national and international stakeholders, NSO should produce and supply data to monitor the progress achieved for national development goals and international commitment of the government. So to fulfill the SDGs. Similarly, national statistical training and research centers should be established to train the statistical human resources, users, and the statistical human resources involved in the private sectors, institutions, and overallly, it is urgent to review the National Statistical System of Nepal for the well-coordinated, functional, and strong statistical system in the new federal structure as envisioned by the new constitution in Nepal. Next slide, please. And these are the references that I made use of while preparing the paper. Thank you all for your kind cooperation during my presentation. Thank you.
Yeah, thank you, Ganesh. I think this is really something good for those who are really looking into how the NSO can be empowered by the more strengthened national statistical system via I think this is very good example how we can advocate the legislative issues to enhance the capacity of National Statistical Office. With that, I think we will move on. Besides the economic statistics, I think this year we have broadened the scope of the APS, and this time we have Dr. Musalim from Pakistan. This is something to do with CRVS. I think CR is really important to National Statistical Office. In fact, I think civil registration basically is one of the key indicators to the country. Perhaps I think the audience can benefit from this presentation. And think I think I will invite Dr. Musalim to proceed with his presentation. Thank you, please.
Thank you very much for this opportunity. Can you people hear me?
Yeah, sure.
Okay, thank you. It's good. I'm very happy. So can I have my use slides? Okay. Actually, this topic is nowadays a very popular topic and is the need of the hour for all countries and especially for the developing countries. And in this, actually, Pakistan is following a roadmap for the development of CRVS system in Pakistan. And so when you talk about CRVS system, we are talking about a continuous permanent process of recording births, deaths, migration, adoption, and these are very critical areas or information for many reasons. Next, please. Next. So this is critical information for individuals. This is critical information for ministries, departments, for SDG tracking, for health indicators tracking, for measuring population dynamics. So there are multiple stakeholders, there are multiple beneficiaries. This is not that this benefits one department, many departments. The current situation in Pakistan for CRV is not very encouraging, and not very encouraging. And we are, you see, like many other countries, we are lagging behind in birth and death registration. Currently, birth registration is like 42%. Death registration is not in a good shape. So this study that we focus a part of the process that we were organizing a national strategic plan, And we focused on Punjab to start with. What are the current scenario of CRBS in Punjab, which is the biggest province, 110 million population? You see the methodology for the study that we had extensive desk reviews on publication for Punjab and for Pakistan in general, and also the international best practices. There was a questionnaire designed, and this was rolled out in 800 peripheral union councils or the registration points. And this is a registration point that 1,800 questionnaires, respondents were included in that. Next, please. And the salient gap that stands for, there was a commitment from the government side, there's infrastructure available like registration points, but there are issues, there are infrastructure, there is internet rollout support available. Administrative structure is complex, and there has to be uniformity, and there are some ambiguities. There are variation in capacities between union councils and registration points. Data quality issues are there. Intersectoral coordination is a big problem for CRBS because this interdisciplinary subject. Flow of information and the roles and responsibility for information to be collated and to be analyzed and disseminated are not clear. The community issues and familiarity in the community about the subject is weak, and people are not clear what is the usage of this particular certificates that we are talking about, because it produces. So there are barriers both on the sides of community and both on the sides of government. These are economic barriers, institutional barriers, legal issues, barriers on both sides, cultural problems, budgetary restriction. So it's a complex situation, and we have to deal with all such kind of issues. Overall challenges that we are facing is certainly there are legal framework, already some legislation done, but that's in piecemeal. At this stage, we are working for an integrated, nationally uniform legal framework for CRBS. And we are undertaking, we need to undertake massive administrative and managerial reforms, and to build the capacity of registration points, and to include innovative methods for collection of data. Previously, data information from community was manual, but now online data capturing and transfer system is being implemented. So one of the major issues is the demand generation, because the public need to know why it's important to get registered, what are the benefits and what are pros and cons of this process. So that's an area we really would like to focus. And with this innovatives and this internet and this social media access down to the village level, probably would be could be a big boost for us in this connection. Further, we are having problems with the information relating to vulnerable groups like disabilities, migrants, and there are so many vulnerable groups which are included. So that kind of information we need, and we are doing some consultations and work with the international donors and partners. All this important vital information could be mainstreamed into health information system with this CRBS system in the country. Similarly, another important problem is that there are hospitals across the country which are, capturing this information on births and deaths. We're capturing information on births and deaths, but it's not mainstreamed in CRBS system. So these are some major problems and major issues, and government has already developed a 6-year roadmap, and gradually this is a massive, because Pakistan is a big, highly populated country, and the challenges are as big as the country is. So we have to deal with this, but certainly the good thing is that there is an institutional arrangement already formed at the federal, at the provincial levels, which are now started working on CRBS improvement in collaboration with the partners like UNICEF, like the vital strategies now, like World Bank also, trying to help us for the development of a national investment case. Thank you very much.
Well, thank you, Dr. Musalin, for very useful information about CRVS statistical compilation in Pakistan. I believe your papers will contribute more to the improvement of CR statistic in Pakistan. Perhaps we can move on to another presenter for this session. I think now we have a presentation from Philippines. This presentation basically talking about
Good afternoon. We're asking everyone to mute their microphones, please.
okay. Is that okay?
Okay, you may proceed. Yazid, you may introduce our next speaker, Manuel.
Thank you very much, Manuel. I think we have a paper about maternal mortality rate in Philippines. I think in Philippines currently there are two kind of data being used by the government. The first one is being produced by WHO, and then another one is being produced by Philippine Statistical Authority. I think this is another good findings that how research from various institutions can improve the capacity of a national capability to produce more quality data, especially in civilization as well as demographic side. And this area is actually in the vital statistics area. So without further ado, I think I would like to invite the next presenter to deliver your presentation. Thank you.
Okay, can you hear me?
Yeah, sure.
Yeah, thank you. Thank you for that introduction. My name is Manuel Leonard Albis from the University of the Philippines. So this study is by the Philippine Statistical Research and Training Institute, or PSRTI, and faculty members of the School of Statistics, University of the Philippines. My co-authors are Sabrina Romasok, Bea Gavira, and Professor Lisa Grace Bersales. So the PSRTI is a government institution that provides capacity building and statistical research not only for the Philippine Statistics Authority, or PSA, but also for the whole Philippine statistical system. This study is a work in progress and was brought about by the need to enhance the maternal mortality estimation. And the PSRTI is working closely with the PSA to provide methodological support and policy recommendations on this matter. So we have come a long way in reducing maternal mortality worldwide. MMR decreased by around 38% from year 2000 to 2017. And since we have an MMR target of 70 per 100,000 live births by 2030 in the SDG, there is a need to measure maternal mortality accurately for monitoring and policy guidance. In the Philippines, we observe a sizable discrepancy between the WHO and PSA maternal mortality estimates in year 2017. The gap is due to the difference in data sources. WHO uses a variety of data sources such as surveys, censuses, and others, while in contrast, the PSA used the National Demographic and Health Survey. Estimation methodology also differs, with WHO using the methods by the Maternal Mortality Estimation Interagency Group, or MMEIG, while the PSA uses sampling-based estimation. Nonetheless, the discrepancy is sizable and would therefore affect policymaking. The PSA is now exploring the use of CRVS to estimate maternal mortality. So the main challenges in the CRVS, in using the CRVS in estimating maternal mortality, are underreporting and misclassification of maternal deaths. Substantial problems of this kind would gravely affect the CRVS estimates. So therefore, this study aims to review the methodology of MMR estimation in the Philippines, evaluate existing methodologies to enhance the estimation, and provide policy guidance for MMR calculation of the PSA. So there are three common maternal mortality statistics: the maternal mortality ratio, which is MMR, maternal mortality rate, or MM rate, and the proportion of maternal deaths, or PM. All statistics have the number of maternal deaths on the numerator, and they have different denominators. The MMR denominator is the number of live births. MMR rate has the number of women in reproductive age, while the PM has the number of deaths of women in reproductive age. In practice, the MMR is preferred as its denominator is risk adjusted. That is, it excludes women with no live births in the reference period. In the Philippines, not all regions have the same level of under-registration of deaths. PSA observed that the large underreporting rates are found among the indigenous groups due to their religious and societal traditions and beliefs. Nonetheless, the PSA aims to reach out to these groups to help reduce mortality underestimation by minimizing registration barriers. The issues of underreporting and misclassification of maternal deaths are also present in other countries. UNMMEIG has two different methods for addressing these issues. The Bayesian CRVS adjustment model aims to correct the issues of underreporting and misclassification for countries with available CRVS, while the Bayesian maternal mortality model is applied to countries without CRVS. So in this study, the aim is to focus on the adjustment of the CRVS for MMR estimation. We plan to implement the Peterson et al. Approach to adjust the CRVS. The framework closely follows the UNMMIGs, wherein the CRVS records are classified as follows: the correctly classified true maternal death and true non-maternal death. We also have the misclassified deaths, called as false maternal death and false non-maternal death. Moreover, the framework also considers the underreported maternal and non-maternal deaths. Peterson et al. Assumed that these 6 classifications follow a multinomial distribution. In contrast, the 2019 BMAT of WHO or MMEIG only has the number of maternal deaths following a negative binomial distribution and is focused on misclassifications. From this assumption, the authors developed a Bayesian analysis framework that uses specialized CRVS studies on misclassification and underreporting and use them as prior information. The CRVS counts are then adjusted based on the sensitivity and specificity estimates of the Bayesian methodology, and in the absence of a specialized study, all parameters are estimated. However, as of the moment, the Philippines does not have a specialized CRVS study on the underreporting and misclassification of maternal deaths, and this which is vital in the Bayesian analysis. We will be limited to using the posterior distributions from the results of Peterson et al., which can only be applied to estimate national maternal death statistics. But since the underreporting and misclassification varies across the regions in the Philippines, we will need this specialized study. Moreover, the Peterson methodology will only provide the proportion of maternal deaths, or the PM, in the CRVS, and the next challenge after this is to estimate the number of live births in the denominator of the MMR. So therefore, our main recommendation to the PSA is to conduct a specialized study on the CRVS to estimate misclassification and underreporting of maternal mortality, which will be used as prior information in the Peterson et al. Estimation. To improve the estimation of MMR, the denominator, MMR denominator, we may explore enhancements on our demographic and health surveys to better reflect the number of live births. Another option is to improve MMR estimation by the completeness of death registration by the methodology developed by Adair and Lopez. But this methodology is focused on the completeness of all deaths and may need to be adjusted for maternal mortality. Nonetheless, the PSA is exploring this methodology for MMR.
Excuse me,
Overall,
2 more minutes. 2 more
thank you.
minutes. Thank you.
Overall, the study explores a possible approach that can help improve the current methodology in computing MMR. And we recommend that future studies may look into the validation of this Bayesian CRVS adjustment. Okay, I want to thank the ESCAP for giving us the opportunity to share this research, and thank you also for the organizers.
Well, thank you, Manuel, for very interesting topic about how you can explore further this exploration into with the collaboration. I think with the PSA and your Statistical Institute, for example. While Ayodel and presenters, I think we have a few questions. I think the second round, I think, is much more related to demographical statistics. I think there are some questions about how they can improve. There's a question from Mahesh Subedi, I think our colleague here, to Dr. Musalin. The birth and death registration rates are very low in Pakistan. The increase of registration of vital events are mostly legal and administratively issues, have little role of the NSO. And what are the motivation for general public NSO to improve the register of the vital events? So I think maybe you can share your wisdom about this, Dr. Musalin.
As I expressed that currently we are very critically reviewing this. There has been some comprehensive and rapid assessments already done, and we are very know about the main focus areas is certainly the legal transformation and administrative reforms that those are desired, and the demand generation. One of the main areas that we are really lacking, and probably that will be, there are three main areas we are working, and probably that would be resolved in the coming few months or so. One is the mainstreaming of CRVS information from hospitals to CRVS, and other is the online data collection and transfer right from the registration points, because currently there are manual, but now online system has been developed and it's been deployed gradually to the peripheral union councils or the village level registration points. So probably that will boost at least some of the indicators. But for the cause of death and death information, we need to mainstream the information from hospitals to the system. So that's being done because, as I said, we have like some institutional arrangements, and this area is being really focused and being taken care of. Thank you.
Thank you. Yeah. Any question from the floor? So far, let me see if you have any question for Miguel or Mr. Ganesh. Huh? So far, just question on Dr. Musalin about the CRVS, how you can improve it for the future undertaking.
There is a question to Ganesh from our colleague, Dr. Musalin, and he asks, who are the other... Before I ask the question, I'm just asking everyone to mute their buttons again, please. Thank you. We're still getting some disturbance. Sorry, yes. Sorry about that, everyone. Ganesh mentioned that there were some stakeholders in terms of improving the process. So Dr. Musalin asks, who are the other partners in the process, and what about political support? This is from Dr. Musalin to Ganesh. And Ganesh, are you there? Did you hear the question, Ganesh?
Yeah, I heard the question. Yeah. Are you listening to me?
Yes, we can hear you.
Yeah. Certainly, there are many stakeholders like ministries and other units, other agencies are also they are also collecting data. They are also generating data, and for example, Central Bank of Nepal is also a stakeholder, and similarly, Ministry of Agriculture Development also publishing data on current agricultural statistics. Similarly, there is Ministry of Health and Population. It is also conducting survey on demographic and health issues. And there are other many stakeholders linked to the NSS of Nepal.
Okay, thank you so much for your answer. There is another question to Dr. Marsalin, and I think he's addressed that one, and he has exchanged contact details with Sarimi. I'm not sure if I'm pronouncing that correctly, but they will correspond with each other and have that question answered more deeply. He's answered it in the chat box, but I'll give him a chance to just summarize very quickly. Are there issues in CRVS collection and matching between the health department and other agencies? If you can summarize the answer for the benefit of the rest of the group. I know that you have indicated that you will talk to our guest Sarimi offline, but others in the chat box and in the group may benefit from a summary of the answer. So go ahead.
Yeah, I think given the challenge of population and the infrastructure we have in the country, I think this is really a big issue now, but we are resolving this issue of mainstreaming hospital information to CRVS. Because even in hospitals, the data collection and coordination, and you see, is not that perfect. For example, this ICD coding is being gradually, but most of the hospitals don't have that. You see, and the death registration and cause of death registration is not being seriously dealt with. So in our upcoming projects, we have a project with working with Vital Strategies on the death registration and certification. So probably, and good news is that all departments, provincial and national, are aware of this deficiency, and they are very keen to have this improvement. Recently, the Punjab government, the biggest promise, they developed an application for hospitals where the data from hospitals is being captured on CRVS indicators and being transferred to the National Database Authority. But this is being done in a gradual manner, and certainly we need to learn from other countries and other situations, like I was just coordinating with Malaysia on that, and let's see how we can be mutually beneficial and helpful in this context. Thank you.
Okay, thank you so much, Dr. Marsalin. I just wanted to jump in just before I hand over to Yazid to wrap up. Just watching the time. Just wanted to apologize to everybody who was experiencing technical challenges. Just please note that all the materials will be published shortly on the webpage, and we will provide the links to all of those materials to all registered participants and guests. And we just wanted to thank the participants and thank also the presenters. There are some questions coming in, but unfortunately we don't have any more time. So those questions that have not been answered adequately during the session, we will collate those and get in touch with our presenters and have them answer the questions and have those published as well. Thank you very much, and I'll hand over to Yazid.
Yeah, thank you, Adel, and everyone, especially for the presenters. I think this is a very interesting session. We managed to get very impressive participants from all the continents, I think. For the wrap up, I think we must congratulate all the effort made by the presenters. I think this will open for further collaboration among us in Asia and the Pacific. Of course, all the materials can be downloaded from the official website later on. And I believe these findings from authors is really useful. Maybe some of it can be adopted to certain countries. And I think for those who really wanted to explore further in terms of scientific effort and scientific measures about various fields like CRVS, how we manage users' perception, and then how we can learn from Nepal experience in improving its national statistical system. I think with that, I think it's really fruitful, a very useful session to every one of us. And we do apologize if some of you face some technical issues over here. This is the first time we have APS virtually. I believe we can collaborate further in the future, and hopefully this is not the end of our exploration about statistical effort throughout the region and the countries. So see you guys for another forum. I think I must congratulate to everyone for an excellent job. Any last message from Ayodele and Ha?
I would like to thank all the organizers for conducting this online session.
Okay,
Thank you.
thank you. It was our pleasure.
Great
Thank you so
learning
much.
experience and a successful session.
Keep in touch, everyone. Have a nice day. Stay safe.
Do keep in touch.
Have a
Thank
good day.
you.
Okay. Thank you, everyone.
Thank you very much.
Thank you.
Thank you.
Congratulations.
Thank you.
Thank
Thank
you.
you.
Thank you.
Yes,
Thank you.
thank you.
Thank you. Thank you. Thank you. Good presentation, everyone.